Survey research by Caitlin Celia and Mark Owanye Jr. Survey research is a process that uses survey questions to derive research conclusions. The purpose of survey research is to understand people's thoughts to help the researcher discover solutions to a problem, create a discussion forum, or plan for quality improvements. If a researcher conducts a survey to collect empirical data, this would be considered a quantitative study. For example, surveys and polls. If a researcher conducts a survey to collect descriptive data, this would be considered a qualitative study. For example, focus groups and on-call interviews. Some survey research can be featured as both qualitative and quantitative. Survey research is powerful because it helps researchers relate to their participants and enables the researcher to communicate with their participants effectively. Survey research methods involve two factors, or two components: the tool used and the time involved to conduct research. Let's first look at the tools. Apps, websites, and email surveys are the most popular tools for survey research. Phone surveys are used for extensive research purposes. Lastly, face-to-face surveys are used for more personal, in-depth research, usually for a qualitative study. Now let's dive into the longitudinal and cross-sectional components. Longitudinal, conducting research over time to observe possible change in behavior and analyze the change. Data collected is qualitative or quantitative. Cross-sectional gathers insights from a target audience in a specific time or era. Data collected is descriptive or analytical. There are two sampling methods used in survey research: probability and non-probability. In general, sampling saves money by allowing researchers to gather the same answers from a sample that they would otherwise receive from the population. Non-random sampling, or non-probability, is significantly cheaper than random sampling, or probability, because it lowers the cost associated with finding people and collecting data from them. Well, so far we discussed the purpose, the type of study, and the methods of survey research. Now let's talk about implementation. A researcher must decide the live survey questions, finalize a target audience, send out surveys, and analyze the results. Now let's look at an example of a case study. This case study was titled "Caring for Patients with Traumatic Brain Injury, a Survey of Nurses' Perceptions." This was a cross-sectional survey. The surveys were electronically sent to nurses between October and December of 2014 at a large Midwestern hospital in the U.S. The sample size was over 2.5 million nurses. Via the data analysis, the authors categorized the nurses into three subgroups based on perceived knowledge, showing that nurses who care for TBI patients the most scored the highest in perceived confidence, but lowest in perceived knowledge, with significant variations in training among nurses. The design, being cross-sectional, is categorized as descriptive research as a time-dimensional design. Descriptive research has the purpose of exploring phenomena in real-life situations when either collective knowledge is incomplete, limited, or does not exist at all, and is essentially always non-interventional. The challenges and limitations of survey research. The challenges of survey research is producing a large sample size. Without an adequate sample size, data can be skewed and the changes or results could not be true. Some participants may not fill out the complete survey, which jeopardizes validity. In addition, response rates have steadily declined over the past few decades, and with increasingly complex healthcare environment, it has been challenging for researchers to identify and recruit survey subjects. Regarding the limitations of survey research, various research articles have discovered that survey research is unable to generalize final results due to limited validity from surveys not being answered in their entirety. Also, the survey questions tend to have less depth because open-ended questions can be hard to interpret during data analysis. APRNs have a greater responsibility to the expansion of collective knowledge, as well as the conduction of research with their more in-depth skill set in education and healthcare and nursing research. Implications not only include the conduction of nursing research with the involvement of APRNs and RNs, but also the participation in research to help apply new quality improvements and practices.